Hey everyone, welcome back to Clinical Physio with me, Khalid Maidan. In today's video, we're going to be taking you through the single leg stand test for greater trochanteric pain syndrome, commonly referred to as a gluteal tendinopathy. So, what do we do in this test? Well, we're looking to see whether or not we can reproduce our patient's pain of pain around the greater trochanteric region, which is where some of the gluteal muscles insert into. So when our patient has a gluteal tendinopathy, that's the place they most commonly point to as being painful. So let's say our patient's irritable side is the right leg. We're going to ask them just to stand on their right leg. And we're going to ask them to hold this position for approximately 30 seconds. And a positive outcome in this test is the reproduction of greater trochanteric pain, the patient's pain on that right side. Now, a couple of things to look out for in this test is seeing if our patient is trying to cheat during the test in any way. And that might be by swaying their trunk to either the right or the left sides in order to change the position of their gluteal tendon during the movement. For example, if in this position our patient tilts to the right, it might be because they're trying to offload the gluteal tendons on that right side. And if that reduces their pain, then it's not really an accurate test. So if this happens, you may well need to reset them and start the test again. And of course, one other thing to mention is you should always compare the right to the left sides. Thank you, Matt. So, do we like this test? Absolutely. It's an excellent test for clinical practice if you're looking to diagnose a gluteal tendinopathy or greater trochanteric pain syndrome. And one of the key reasons is because the sensitivity and specificity are so high. It's a really accurate test for this condition. One thing to mention is that it can be quite an irritable test. So for example, if you find that your patient stands on their right leg and they've got quite an irritable gluteal tendinopathy on their right side and they start talking about pain after 3 or 4 seconds, you can stop the test there and then. You've gained the information that you need. It's highlighted that their pain is present and that's a positive outcome. So thank you so much for watching and we'll see you again soon right here on Clinical Physio.